So we continue for the respiratory, the peripheral pulse rate. So first, we need to ask if the patient was she was comfortable in this position, and late because as you can see, the patient was wearing a sleeveless. Look at me there. Look at into the video, and then we need to should be the hands was placed into the side point normally and radial pulse is taken, and then we need to place the two fingers into the index, middle, and right, like this, and then we need to count in. We need to count in 60. 1 minute the pulse rate. And observe the first minute, the regulatory of the pulse, and count for 1 full minute. So as you can see earlier, I said 1 minute. We should count with 1 minute. And after that, if we get the pulse rhythm, the pulse rhythm and the volume, we should to note automatically into the chart to the chart. So let's continue for assessing the respiratory of the patient. So let's the patient in comfortable position, and then place to the, and we need to count the RR of the patients into 60 seconds using our watch, and use the two fingers into the index area. And when the abnormal breathing pattern is less than 60 seconds, carefully observe if the respiratory. So note if the rhythm, note the rate and the rhythm and character of respiration. So let's continue counting the respiration of the patient using the watch. 60 seconds of counting. If the respiratory rate was abnormal findings, if the patient can't breathe normally, or shall we say difficulties of breathing. After we get the respiratory rate, we need to write automatically in the charts. So that's all.